First of all, I would like to thank the members of the Congress Committee for providing us with this presentation. I'm Dr. Recai Acı. I'm working in the biochemistry laboratory of Samsun Training and Research Hospital. In this study, it was aimed to investigate serum 25-hydroxy vitamin D, magnesium, and phosphorus levels of SARS-CoV-2 PCR-positive patients and healthy individuals. The coronavirus disease, SARS-CoV-2, which emerged in December 2019 and caused a pandemic in a short time, has become a major public health problem. As you know, it's an infectious disease caused by a new coronavirus called SARS-CoV-2. The severity of the disease may be correlated with the viral load in the patients and modulated immune responses. Due to the inoperated and irregular functioning of the immune system, the virus replicates rapidly and causes a devastating inflammatory response characterized by increased levels of serum inflammatory markers such as C-reactive protein, interleukin-6, tumor necrosis factor, and erythrocyte sedimentation rate. So we need to make vitamin D through the interaction of our skin and sunlight. So UVB radiation enters our skin from sunlight. There is a vitamin D precursors in our skin called 7-dehydrocholesterol, and that 7-dehydrocholesterol gets activated by the UVB radiation and becomes D3. That D3 is not the active form of vitamin D, but it enters the circulation and then goes to the liver. In the liver, it gets hydroxylated and it becomes 25-hydroxy D3. That is not active form of vitamin D, but it is the most abundant form of the vitamin D in our body. To become an active vitamin D, conventional wisdom was that it had to go to the kidneys and undergo a second hydroxylation, where it become now 1,25 hydroxy vitamin D3. Vitamin D is a fat-soluble vitamin that has effects on the immune system. Its deficiency has been associated with acute viral infections. It has been stated that vitamin D levels in individuals may be necessary for antiviral effectiveness. It has been reported that vitamin D exerts a protective effect on alveolar epithelial cells, preserves endothelial integrity, and also induces the expression of angiotensin-converting enzyme 2. Also, phosphorus and magnesium are required for ATP synthesis and regeneration. Due to reduced food intake during infectious disease, essential components such as phosphorus and magnesium for higher ATP requirements of activated immune cells, mobilized from stored reservoirs in bones and muscles by the release of stockins. Cases of rhabdomyolysis observed in SARS-CoV-2 patients may indicate intracellular ATP depletion and perhaps severe hypophosphatemia. Magnesium is necessary to move vitamin D in the bloodstream and activate vitamin D. Magnesium deficiency may also reduce the levels of active vitamin D, 1,25-dehydroxy, and impair parathyroid hormone responses. Therefore, optional magnesium levels are required for optional vitamin D activity, with the depletion of intracellular ATP due to low phosphorus and magnesium levels, membrane instability, and ATP release into the extracellular space. Cell death may occur via necrosis. However, extracellular ATP may act as a distress signal and initiated overaction of the immune system with the possible outcome of cytokine storms or ARDS. In this study, we were aimed to investigate serum 25 hydroxy vitamin D, magnesium, and phosphorus levels of SARS-CoV-2 PCR positive patients and healthy people. Our study was carried out after obtaining the necessary ethics committee approval in our hospital. 232 SARS-CoV-2 PCR positive inpatients and 250 healthy individuals were included in this study. Of the SARS-CoV-2 PCR positive inpatients, 198 are in the ward and 34 are in the intensive care unit. A diagnosis of SARS-CoV-2 was made with the PCR. The data of these patients were retrospectively analyzed with the information provided by the Hospital Information Management System of our hospital. The 25 hydroxy vitamin D, magnesium, and phosphorus levels of this patient were obtained from the data in the patient's file. However, in our study, serum 25 hydroxy D level was less than 20 nanogram per milliliter, was considered severe insufficiency. 22 30 nanogram per milliliter was considered insufficient. 3200 nanogram per milliliter was adequacy, and more than 100 nanogram per milliliter was toxicity. As you see, descriptive information and laboratory findings of the groups are given in Table 1 as mean plus minus standard deviation. Here you can see the graphics. As you see, vitamin D values in SARS-CoV-2 patients were statistically lower than the values in the healthy group. Discussion. Consequently, vitamin D also affects phosphorus and magnesium metabolism, which may play a critical role in the pathogenesis of SARS-CoV-2. Therefore, we suggest that patients with SARS-CoV-2 should ideally be monitored and treated for phosphorus and magnesium deficiencies in the early stages of infection. Phosphorus and magnesium supplementation and vitamin D can also be applied as a preventive strategy in at-risk population. Thank you for listening to me.